Hello, I am Dr. Vikas Gavdi. So I am a plastic surgeon at Kyra Aesthetic Clinic and I specialize in the rhinoplasty surgery. In fact, it is the septo-rhinoplasty. I always do it together. So today I want to highlight what is dorsal hump. So dorsal hump is the most common query. We get many calls and we do a lot of surgeries for the dorsal hump. If we see the nose from the side, there is elevation in the top or middle of the nose, that is called the dorsal hump. The nose is elevated. Mostly it is associated with the droopy nasal tip. The nasal tip is long and drooping downwards, and second is the nasal deviation. So many cases has also got the deviated nasal septum. So what is the treatment? So it is always treated surgically. So the surgery is called septorhinoplasty, and I always believe in the open rhinoplasty, and I am doing this for many years with the latest preservation rhinoplasty, and we are achieving very good results. So in the dorsal hump, we give a small cut in the columella, which is hardly visible. We lift whole of the skin, we expose the skeletal part of the nose, and we remove the part of the bone. Then we rasp the bone. We have special pisotome for the bone chiseling and for osteotomies. Then there is a cartilage in the center, so we decrease the height of the cartilage, and part of the cartilage which is lower down, we harvest the cartilage and use it as a spreader graft, because spreader grafts, it helps in preservation of the breathing. And second is, when we correct the septum, we place it on both sides to hold the septum so it is never deviated back. And second is the part of the septum, we use it in the front, that is the columella strut, to raise the nasal tip. Even after surgery, if there is any fibrosis or there is weakening of the tissue, so these cartilages holds and protects any weakening of the nose or drooping of the nose even after the surgery. So these techniques comes under advanced rhinoplasty techniques, because using of spreader grafts, columella strut, using of pisotome, and the techniques of preservation rhinoplasty, believe me, these are done by very few rhinoplasty surgeons, and I am one of them. In the dorsal hump surgery, this is a daycare surgery. You have to come in the morning, say 9 o'clock, empty stomach. The surgery takes around 2 to 3 hours under general anesthesia, and you will be sent home on the same evening. Follow-up visits is after 2 days and after 7 days, and there will be a nasal splint mostly for 7 to 10 days. And last is the post-op care. So everybody is worried that there will be pain or swelling after the rhinoplasty surgery, or you will be out of the social life. But pain is there, but it is, none of my patients, they complain of the pain, and we give painkillers only for 7 days, antibiotics for 5 days, and swelling varies from patient to patient. But if we are doing it very gently with the special smaller instruments, the swelling has been reduced. And last is the complications. So we hardly see any complications. So complications are very rare after the rhinoplasty surgery. So I have never seen any cases of infection or any bleeding after the rhinoplasty. So all our patients, they vary from the different age group, from the younger to the older patients, and all of them are happy. Thank you.